Kamon man long slur ringkat bat kaman ba shong Khia ka shong ha Jinglong scam ba jingjek ba start ka jong pi. Katata haya kakali ban san ya kalintiya ka jong pi. Kalaban long ka jong pi menta. Bok ya katata haya ha frang motors like korangi. Ne phone hunu number bala ai harum.
Ka mentri jong katnat ka kot ka Khia ka jylla ka Dr. MM Green Lingdo ka lapin tip ba ka badon kam ha hapo katnat ka kot ka Khia ka long ban Pynbha ya ki Nongtrei ki balatibet namar kom ka long mata ki Jingduna ba ki Nongtrei hapo ki hospital Sorkar ba kinthop na do ki nurse ki paramedical ki doctor specialist bat ki ki doctor ban sumar ya ki nongpang ene ka las ki ublay ha ka jinglang jong mentri rang ba ka jylla konrat ki sangma bat ka mentri ka bakmi ya katnat ka kot ka Khia Kila shong ya ke jingelang ha ka ba penchon nong rimba ya ke Jingtreikam ya ki civil hospital ki badon ha ka jylla bat kumju ki hospital ki badon ha borok be ki district bat ha ni ki jingelang layekran nagamta ban Pynbha ya ki Jingtreikam ki bakir ki ha ki jaka ai jing sumar habakran cikilat pathai Khubor ke Dr. Ramtrin kalai thu bakal bente bahu mentu rangba ya ki Jingtreikam ka bakir ki ha ki jaka ai jing sumar kabadai ban Pynbha yi ki Nongtrei ki belatibet bat kalai thu ru ba haki kindat sngi ki ban wan anya kran byang ya kani ka phang bat mentri rangba nagamta ban perkhat chu ya ki Jingtreikam bat khamtam ban wat ya ki lat bei pisa ban Pynbha ya ki Jingtreikam ha ki jaka sumar bapang kalai thu ba ka Sorkar kan Shim kuma arpusa do life riu banai ban bisarnya ya ki Jinglong jingman bat ban Pynbha ha ka bai de ba ki Jingtreikam ha ka kot ka Khia Shushu kala ong ba ka long ka badon kam ban ai shushu ya ka jingsiu na lo ka tulop ya ki Nongtrei ha ka kot ka Khia khamtam ya ki tu ki ba ban trei she ki jaka nong kandong namar kum ba ka long menta ki babun kim kwa ban trei she ki jaka nong kandong bat ka Sorkar kan wan ra da ka policy ba ki tu ki ba trei ha ka tnat ka kot ka Khia ki dei ban hab bait ban trei sha ki nu ki jaka wat la ki dei sha ki jaka ki ba kham chngai bat ki ba e
fruitful interaction with the Honorable Chief Minister. The assignments before the Honorable Chief Minister this morning were basically to evaluate the performance of civil hospitals and district hospitals across the state of Meghalaya. We had reviewed the positions, the performance, requirements for infrastructure. We also reviewed the indexes for for evaluation of performance, and it was decided today that amongst the most critical requirements in all of these hospitals was the HR, and the Honorable Chief Minister is now informed about the shortfall of nurses, shortfall of paramedical staff, shortfall of specialists, shortfall of medical doctors. This evaluation was done with the purpose to ensure that we are able to track the performance of all of our hospitals, and we will await for another interaction with the Honorable Chief Minister to see what are the other areas and what are the financial inputs that government will be taking to ensure that our health system improves substantially. We are giving ourselves about 24 to 36 months, and we will evaluate the performance accordingly. We have also taken a decision that it is important for us to incentivize services of health personnel across the state of Meghalaya. You will notice that in very far-flung places of services provided to the public via the health department, there will always be a resistance by health personnel across the board. So we are looking at the initiation of a policy that will firstly ensure that everyone in the system, in the health department, must have a compulsory difficult posting. Everyone in the health system should not, for example, take recluse to the fact that we do not have provisions for housing of the health personnel whenever they're posted out. We've evaluated the scales of pay of all health personnel, and we have seen that there are provisions for acquiring of housing facility for doctors, housing for facilities for nurses. We hope that we will be able to evaluate ourselves. This is a self assessment. Before any third party comes, government should be seized of what are the potentials, weaknesses, strengths of our own services. We are also a little alarmed at the fact that referrals to higher facilities is a common practice in all of our health centers, our health hospitals, government hospitals. We are going to find out now, we're going to invest substantially on further detailed researching. Why is it that referral of patients is a common practice in all of our uh, government hospitals? Why is it that patients uh, ask for referral against medical uh, advice in most situations? We are going to try and see whether or not the government can handhold the health department to ensure that we are able to provide the basic of all basic amenities to our citizens wherever they are located without pressurizing patients to move out of their own areas, own homes, and to travel distances across either in the state or across to other states for their medical treatments. That's one thing that we feel is a top priority in the government, and this is what the Honorable Chief Minister reviewed. He has visited the Jowai Civil Hospital. He has visited, of course, the his own in his own constituency, the Tura Civil Hospital. We are shortly going to have a review meeting even in the civil hospital Shillong, and we're going to see how best we can turn around this faith that the public have in our health institutions. Intervention of the Honorable Chief Minister, and we hope, like he has created a magic in reduction of maternity deaths, we hope that we will be able to have this reduction overall in the entire health system. We also talked about availability of essential drugs. That is a very, very important area, and Honorable Chief Minister has made necessary advices to the department officials to ensure that we generate individual dispensaries in every civil hospital or MCH hospital or these subdivisional hospitals across the state of Meghalaya. That was a very interesting interaction. So, more or less, in a nutshell, this was what we discussed. One thing that evolved in that discussion was the very fact that specialists, how do you enthuse a specialist to join government services in the state of Meghalaya? We must have adequate incentivization. So that has been decided, and officials will now go back and plan various proposals or packages to offer to these specialists so that we are able to fill all the vacancies in the specialist category. As far as MOs are concerned, we are well aware of the fact that we as a state are suffering greatly from this crunch of medical doctors. We have a big gap even in ordinary MOs. So we now are going to review all of these deficiencies, and we hope that we'll be able to bring out more attractive packages for the doctors. There is no dearth of nursing talent in the state of Meghalaya. We have qualified nurses. We have qualified nurses who are BSc and above. We have qualified nurses uh, who are GNMs, ANMs, and we have this huge backup of the community that is lending a very important connection between the health services and reaching out to the public. The village health councils are an important and also are a unique factor in the state of Meghalaya. We want to cash in on this. We want to ensure that community participation will be the magic mantra to turn around an otherwise very inadequate system where public have this perception that if you go to a government facility, nothing happens. So we want to send this message across. Let us see. Look at the indicators of our failures and our gaps, fill them up, and push the system so that we perform better. So this is something which we discussed and I think has great relevance and great potential in the state of Meghalaya.